we will move on to our second talk. And for that, we have Dr. Kanika Dhawan, who is a brilliant, brilliant person. She's trained at PGI Chandigarh, a very prestigious institute of our country. And she's a professional who goes beyond the dryness of any speciality. And she's getting expertise in other related fields like neurodevelopmental techniques. And she's also a therapeutic taping practitioner, which is excellent because in cases where you are unable to do certain, you have to do something, but you have this pain. So she will tape you up with tapes, and she's doing dry cupping and dry needling and myofascial release. Today, we have invited her to deliver a talk on how to manage lumbar canal stenosis and how to manage sciatica and its pains by exercises. So, welcome, Kanika. Over to you.
Good morning, everyone, participants and their attendees. And really heartfelt gratitude to Dr. Nirja for having me today at this platform. And I think this is really a great initiative by Indian Menopause Society. These two topics are really very relevant and important, especially in menopause women. And for the clinicians like you who have to stand long standing hours while they're performing surgeries, so they feel discomfort. And when to talk about these two topics, basically, so there comes a thing that we always are confused where to start with. Do we need to see an orthopedician? We need to see a neurophysician? We need to see a physiotherapist? And I really felt very motivated after Mrs. Tarveen's speech. And I think today is the day when I'll have a positive mindset. I need to make some changes in my life as well. So there is a one basic approach that I do for these two topics. We call it extension bias and flexion bias. I'll be talking about the details later on, but to start with, there is an approach of extension bias and flexion bias. What we're talking about right now is that if patient approaches me and he or she is feeling comfortable flexing in positions where he or she is maybe bending her knee while walking or while performing daily activities or maybe flexing. So that approach is basically for the lumbar spinal stenosis. That is a case where patient is going to feel more comfortable. Whereas in this sciatica pain, there can be both approaches. The patient can feel better in the extension exercises as well as in the flexion exercises. So I'll be starting with the sciatica. So there is a relationship between lumbar spinal stenosis and sciatica. Basically, sciatica can be caused by lumbar spinal stenosis as well. So when we talk about nerve root irritation at the lumbar level, due to its reduction in the spinal canal size, we call it lumbar spinal stenosis. But if there is any kind of symptoms produced in your in your back or your leg extremities, so we call it sciatica. It can be due to nerve irritation or the compression of sciatic nerve. So now I'm starting with sciatica. So sciatica is basically a set of symptoms in which the patient will experience lot of numbness, paresthesia, and pain in its lower extremities. And this sciatic nerve is basically the longest and thickest nerve in our body. Its nerve roots are originating from L4 till S3, and it supplies the posterior back of our legs, and it can indirectly supply to the leg and dorsal aspect of our foot. So sciatic nerve, when we talk about the causes, these can be degenerative. Let's talk about, again, like I said, spinal canal stenosis. It can cause sciatica. It can be due to compression disorders, like if suppose there is any tumor, if there is any kind of hematoma, if there is any kind of abscess in your gluteal region, it can cause suppression or compression of the sciatic nerve. Next can be due to arthropathy. These can be because of malpositioning of the body. Not in females, but actually males have the tendency that they always put wallet in their back pockets. They always put phones in their back pockets. And while they're sitting in an upright position, So there is a tendency that the nerve can be compressed and you can feel or experience pain. And then in pregnant women, we see sciatica, in which the weight of the fetus is very much unbearable for the pregnant woman while she is in sitting posture. The next can be when you're sitting on a hard surface. So basically, in sciatica, you will feel the patient complaining about the symptoms and signs in its due course. So if I talk about it courses, it enters into the gluteal region. From in it sorry, it will enter into the pelvis region. From pelvis, it is actually present anterior to the piriformis. So here is a tendency that it can be inferred between the piriformis heads, and this condition is basically known as piriformis syndrome. So when we'll talk about the management part, we'll talk that in these kind of syndromes, what we have to do is we can do the dry needling for the part, we can stretch the piriformis, and there will be relief from the symptoms. Next can be when it enters the gluteal part. Here in gluteal part, it lies posterior to the muscles that actually rotate your hip externally. So again, here is a tendency that it can be compressed somewhere. Then it will enter and run vertically till the apex of the popliteal fossa, where popliteal fossa is basically back of your knee. And just starting at the back of your knee, it will further divide into two distal nerves. So again, at the popliteal fossa, it can be again compressed. The last reason that I recall is sciatic neuritis. In this, there will be inflammation around the myelin sheath that can cause little bit of discomfort. So now if we talk about the clinical features of sciatica, that the patient is coming to me and he and she is experiencing, the first and most thing will be back pain. And it will be mainly one-sided back pain, generally in the region of upper buttocks. The next thing will be unilateral leg symptoms. And there will be tingling, burning and numbing sensation. Paresthesias may or may not be present. When I'll be examining, I'll see some motor and sensory changes. There can be weakness of hamstrings. And while talking about the sensory changes, again, there can be diminished light touch, proprioception, diminished vibration, etc. And then on examination, again, I can see that the ankle jerk reflexes are a little bit diminished. So apart from this, now I'll talking about the management part. So again, like from the at the start, we were talking about the extension and flexion bias. So in this case, I'll be experiencing both of the patients. So before we actually perform any kind of exercises, nowadays we all are very technologically savvy, and we get bored very easily when we are told to do something or any kind of particular set of exercises. We tend to incorporate ourselves into, like, say, aquatic therapies, our Pilates practitioner, our gym instructor, our yoga therapeutic exercises. So what these all do is that they actually confuse you. But to start with, there are only 4 to 5 basic exercises that are going to help you with the same. So for the management part, it again can be divided into 2 stages, acute and chronic. Rest is never advisable in the case of sciatica. So for the acute part, the first thing you have to try is to manage your pain. Pain can be managed by drugs, or if you talk about the physical therapy modalities like ultrasonic massages or laser therapies, or let's say TENS. So TENS is kind of electrical stimulation. Next thing can be prevention of edema. So while you are sleeping, you can always elevate your limbs. You can give a effleurage massage. You can wear compression stockings. And next is that we have to maintain the properties of muscle. For that, we can use any kind of electrical stimulation that will actually artificially contract your muscle and help release the extra toxins out of the body or from that muscle spastic area. Next thing we can do is use some assistive devices like lumbar belts, lumbar corsets, or ankle foot orthosis while you're walking. Now I'll be talking about the lumbar spinal stenosis. It basically happens because of there is reduction in the spinal canal size. And again, the symptoms that will be felt are there will be heaviness in your lower limbs, there will be weakness. Again, the paresthesia may or may not be present. Its etiology can be divided into 2 categories: Primarily, that can be congenital in the conditions like achondroplastic graphies, or maybe during the postnatal development. Secondary changes can be due to any kind of local infection, due to trauma, due to any kind of surgeries, or maybe a metabolic that can be due to fluorosis or Paget's disease, etc. So again, for the lumbar region, if I talk, the patient is always going to come to me complaining about the heaviness in the legs. There is a very typical characteristic of the lumbar spinal stenosis called a simian stance. In that, the patient while walking will experience extreme pain in its legs. And to avoid that, actually, he will adopt a posture that is forward bending posture. And along with that, he or she will walk always flexing knee and hip. So for its management part, if we say, and if we go into the little bit of pathology of lumbar canal stenosis, what basically happens is that there is degeneration of intervertebral disc. Like we have talked, it falls under the category of degeneration. There will be degeneration at the level of lumbar vertebrae that will cause instability. The instability at the joints will further cause the hypermobility of joints. That will further cause joint tightness. Sometimes joints can be ankylosed, further causing the stenosis. And because of the stenosis, there can be some vascular compromise to the nerve vessels also. So the patient might feel neurogenic claudication. That again can be explained by the patient as heaviness or weakness in the legs. So if I'll combine both of the topics, the categories of exercises that I'll be prescribing is lumbar flexion exercises and lumbar extension exercises. For both of the things, the most important thing to keep in mind is we should always consult a physiotherapist rather than seeing videos online. Because I've seen many patients, they go through online videos, then they come to me and they'll tell me that, oh, okay, I was doing this exercise and I think my pain has exaggerated. The second point, when you keep it in mind, is every time you are exercising, you should keep a hot pack. It may be handy, or it can be if you're at home or maybe in a clinical setup. You always give some warm heat to the structures before you actually start exercising. That will help you to release the pain and help you to do the better set of exercises. So I think before I start with the videos, so do we have any kind of questions before I start with the demo?
No, I think please proceed with the demo.
Okay, so I'll be playing some videos. Actually, those videos are very short and I'll be talking simultaneously. So there may be instances that video will get over before I'm done with my speech. So I'll start sharing my screen. I hope my screen is visible to everyone now.
Yes,
ma'am. It's visible, ma'am.
So to start with, you can see that I'm lying down supine. Here, what I have to do is I'll flex my hip and knee at 90 degrees and I'll stretch it towards my chest. So I'll pause it here for a moment. So exercises where we have to do stretching like this, like holding your leg and bringing it towards your chest. The most important thing to consider is that I should never be holding the knee from the upwards. Suppose कि अगर आपको osteoarthritis है or maybe you're suffering from any inflammatory condition like rheumatoid arthritis, तो इसमें आपका जो पेन है वो और ज़्यादा बढ़ जाएगा. अगर आप नी को उसके ऊपर से पकड़ेंगे तो पेन is obviously going to increase. So this is the basic thing that whenever you're doing these kind of exercises, you need to hold your leg and knee by putting the hands like I've just shown. I'll play the video. So I can hold it here for 30 seconds. Then I'll repeat the same for the another leg. I'll stretch it towards me. I'll hold it here for 30 seconds and relax. The next set of exercise can be flexing both legs at the same time, holding them and stretching. In this, you have to make sure that your pelvis is off the ground, and then relax. So here, what I'm doing is I'm actually basically flexing my lumbar. So before you do this exercise, if you're suffering from any knee condition, this is not preferable for you. But if you think you can do it easily, you can do it, you can perform it. So what here I'm doing is I'm in half kneeling position. I'll place my buttocks over my feet. Now here I'm going to stretch my arms as much as I can. And then I'll slowly bend towards the ground. The main thing to be kept in mind is when you are doing the stretching exercises, the repetitions can be 3 to 5, but you have to hold it there for 30 seconds. So now I'm playing the next video. So here what I'm basically doing is I'll be extending my lumbar region. I'm here on my shoulder and arms, 90 degrees to the body. I have to extend my neck. I'll feel pressure on the lower lumbar region here. I'll hold it for 10 seconds and then relax. I can further advance into the next position that I'll completely come over my arms. I'll show you like this. This is the next advanced stage. Again, you have to hold it for 10 seconds and then you'll relax. Here, what I'm doing is that I'm in standing position, placing my hands over this waistline, again extending my neck and spine. I'll be holding it off for 10 seconds and repeat it for 10 times. Next exercise here I'm doing is, so basically before I start this video, I think agar hum kisi cheez ko bolte Ramban. So in my clinical experience, I've seen this exercise to be Ramban for sciatic nerve. What I'm doing here is that I'll be mobilizing it. There's a thing called sciatic nerve mobilization. Actually, I've placed a towel and it was a little bit matching to my top, so you cannot see. But you have to place towel that can be 6 to 10 inches in length below your waistline. What I'm doing is that I have to lie down supine. The affected part, the leg which I'm experiencing the most painful, should be kept upwards. It should be facing upwards. Now I'll start the video for you. I'll flex the lower limb for the better stability. I'll dorsiflex the foot. Yeah, so here I have flexed the lower leg for the stability so that you might not be doing the inward motions. Now I'll bring the leg forward into the transverse plane, hold it here for 30 seconds and go back. So in this exercise, you're going to feel the stretch along your leg. The video has been paused, I'll play it again. And in this, the thing that is very important, it should not be beyond your pain. And it can only be performed into the chronic stages, because if you'll perform the sciatic nerve mobilization in acute stage, like I've talked about sciatic neuritis, if you're suffering from that, the nerve can be into the recovery phase. So if there is any scarring, you are actually going to break it. So healing process can be slowed down. So you have to make sure you're doing this into the chronic stage only, basically after 2 weeks setting of the symptoms. Now I'll be playing the next video. So here what I'm doing is I'm doing dynamic exercises for my stomach. Abdominals have played very important part in low back exercises. There is a very great emphasis on strengthening your lower abdominals. So what here I'm doing is you have to place hands at 45 degrees on your, just above the pelvis on your rectus abdominis. You have to feel it, and then you have to inhale deeply and exhale. And along with that, you have to contract your abdominal muscles and your obliques, lateral muscles. So this is commonly known as abdominal bracing. If you think this is a little bit hard, you can do just tummy tuck in, simple. What you have to do is you have to inhale, you have to tuck your tummy in and then exhale. I'll be pausing the video here for a moment. There are some researches that show that if you're doing any kind of abdominal exercise, for mainly for lumbar spinal stenosis, if you're holding your breath, like your therapist has, instructed you that you have to hold your breath, or you have to tummy tuck, you have to do the tummy tucks and hold it for 10 seconds. But it doesn't mean you have to hold your breath. You need to keep counting, because if you're holding your breath, you are going to activate Valsalva maneuver. In that, we are going to close our glottis and there will be increased abdominal pressure. that will further increase your back painage. So to avoid this, you need to keep counting like 1, 2, 3, and then relax. So I'm playing it again. This further can be modified into the dynamic part, where you can lift your one leg, bring it towards your body, and then relax. So like this, I'm flexing my both hip and knee, and then relax. Bring it back, relax. While you're doing this, you have to make sure that you are actually incorporating your abdominals into this. Apart from creating a force from your hips or maybe lower back, you need to contract your abdominals simultaneously. Next exercise that I'll be performing is cross cycling. This is again for the abdominals. You can do this very easily. You can hold it again here for 30 seconds or as much as you can. While you're performing any exercise, pain cannot be an issue. So if you're experiencing pain, so you need to slow down, you need to cut down that exercise, or maybe you need to go and talk to a therapist. That can be modified into any further position. So here, relaxing again. Next exercise is, this is basically static lumbar extension exercise. What I'm doing is, I'm into prone position. I'm lifting one leg and holding it there for a few seconds, maybe 10 seconds or 15 seconds, and then come back to the normal position. This again can be further modified. Instead of lifting one leg, you can lift both of the legs simultaneously. But you have to keep one thing in your mind is that your neck should be in extension. So for this position, I've kept my hands like this under my chin to provide any stability, and then performing the exercise. So this is basically dynamic lumbar extension exercises. So I'm into the quadruped position. I lift my one leg, hold it there for a few seconds, and then come back. I'll perform the same for the other leg. Bring it, stretch it fully, come back. I'll repeat it with the right hand, and then with the left hand. I'll bring it in air, hold it here for 10 seconds, and then come back. So this is basically very basic to start with. If you want to modify or take it into the advanced stages, what you can do is simultaneously, like if you're lifting your right leg, you can lift the left arm along with it. So it will help you with the things like better proprioception, better balancing. And while you're performing this, you have to tuck your tummy in. Your abdominals should be contracted. They should be actively contracted in this. So I'm playing the next video. So before I start this video, it is very important to know that isometric exercises nowadays are very much overlooked. I think that is a very basic and very important to be emphasized on, because those can be done with least functional mobility, and it will provide you maximum efforts and maximum changes in your muscles can be seen. They're also known as muscle setting exercises. So what here I'm doing is that I've flexed my hip and knee. My ankle should be on the ground or the mat. Then I'll be pressing my ankle against the ground. So here what is that I'll feel the stretch, I'll feel the contraction in my gluteus, my thigh, my hamstrings, and my legs simultaneously. So this one exercise is enough to do all the isometric exercises for your lower limb, saving your time. So I think that's all for with the exercises part. I think exercises were clear.
Yeah, they were clear and they were very beautiful. And what a lot of effort you have done to actually show us all these exercises. And it's always nice to have a trained person tell us all this thing. So, because say when you go for yoga, that is for the entire people who are doing that yoga, but you have a particular problem. So when you are into any yoga program or anything, then you know that what you have shown today, what Dr. Kanika has shown, that is what I can do. So the rest for those exercises, you can stay still. in your yoga program and continue to do what you have learned to
Yes.
do.
I think if you're going to join any kind of group exercises, let's say Pilates exercises, yoga exercises, maybe aquatic therapy, swimming or so. So I think you should talk to your trainer beforehand. You see, I have this condition and I cannot perform these set of exercises. So what they can do is they can make you a different set of yoga positions. And actually, there are a lot of patients who come to me and ask me, ki, ma'am, do you think that I can stop these yoga exercises? So I don't think there is any need to stop yoga because the our body is very sacred. And I think we know our body best than anyone else can. So while you're performing any kind of exercise, any kind of position in yoga, so you can feel you yourself know that are you feeling any better? Is it increasing any pain? And most important, when we talk about the middle-aged person or in the post-menopausal women, the osteoarthritic knee, or it may be due to any other inflammatory condition, is very common. So what we in yoga are basically, there can be some positions where your knees are crushing against the ground, and that will further increase your symptoms rather than decreasing it. So we ourselves can be vigilant in times. We should never ignore the symptoms or the signs the body is telling. We should always be in balance with that.
Yeah, actually, the take home message here is that whenever you have any problem, so you discuss with your physiotherapist that this is like for me, I do yoga 3 times in a week. But those postures which are not good for my particular condition, in those I stay still or I do what you have shown today. So
Yes.
it's good to take opinion from the physiotherapist and continue to do your yoga program with an alertness, not to do some and to do more of something else. So
Yes.
being in touch with a physiotherapist is very important. And I thank you, Shobha.
Yeah, I think women with chronic skeletal musculoskeletal problems should look forward to some kind of a very dynamic schedule where they should look towards response of their body to the exercises that they are doing and discuss it with the physiotherapist, because I often come across complaints that we started this particular thing and it has led to more problems, right? So I think that the constant, as Nirja has very well said, that be in constant touch with the physiotherapist. I think physiotherapy is a huge role in musculoskeletal problems of elderly women, of menopausal, even younger women who take up sports activities. I think today there is a lot of inclination towards cycling, swimming, and so many other sports activities. So people need to be careful. They need to protect their joints, and they also need to know that as we grow older, there is osteoporosis, there is osteopenia, and that really changes the picture a lot. So, and it actually becomes, not just exercise, but also replacement of the calcium supplements, the dietary calcium intake, other control of other comorbid conditions, for example hypothyroidism, chronic steroid intake. These are the ones which impact musculoskeletal health a lot. So your role is so crucial, Kanika, in the overall health of women, their mobility, because I think Dr. Pushpa, Dr. Arti agree that we are going to give a message about being fit at 80, fit at 85, and fit at 90.